Welcome to Magnolia Medical Minutes, your local source for medical advice direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of Super Talk Mississippi Media, and today's special guest is hospitalist Dr. Janet Bucolla. Janet, so nice to have you today.
Thanks so much, Andy. It's a pleasure to be here.
So I'd love for you to tell me, what is dementia?
Dementia is an umbrella term, Andy, that healthcare providers use to describe a series of medical conditions which lead to irreversible, severe degeneration in the thinking parts of our brain. In order to really understand dementia, we actually have to understand how the thinking parts of our brain age. So first of all, brain aging begins, I hate to say this, in our 50s. We may have the occasional senior moments where we walk into the church or the grocery store and we can't remember the name of the person that we see. We forget our keys at home. We walk into a room and forget why we walked there. Those one-offs, oopses, they're fine, they don't matter. It's when we start to have consistent moments of oopses in multiple different areas of the higher thinking processes in our brain, and when those consistent oopses happen in a way that make it unsafe for us to take care of ourselves, that's when we suspect a diagnosis of dementia.
When should I be concerned that a loved one might have a form of dementia?
What I encourage family members and loved ones to do is to start paying attention. Does mom or dad have on the same clothes every time you go to see them? Have you noticed that they've stopped cooking? There are habits that they used to do their whole entire life. They love to play bridge or crochet. Now all of a sudden they're not doing that anymore. It's when you start to see these changes again and again that it's really important that you connect with a healthcare provider for your loved one.
Tell me, how is dementia actually diagnosed?
The diagnosis of dementia is actually what doctors call a rule-out diagnosis. We'll do a series of blood tests, often a scan or two of someone's brains, and then we'll offer a series of questionnaires and thinking tests. And we take all of that information first and foremost to make sure that there aren't any other diagnoses that could be mimicking the symptoms of dementia. And if we don't turn up anything else and the tests all add up, that's usually when we'll give a label. And after we give a label, we'll give a subtype and we'll name the stage of dementia.
Let's say we've been diagnosed or parents have been diagnosed, or whatever that looks like. What are the treatments that are available for dementia?
We have 2 classes of medications that can slow down the brain loss and help keep someone functional for maybe a year or 2 of life. However, we don't have any medications available or treatments available that can reverse or repair the brain.
It's a difficult disease and difficult thing to deal with, but there's hope. Well, thank you for your time today to discuss this tough topic. Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical advice directly from the doctors at MRHC in Corinth.